Coming up on the Sky News Daily with me, Niall Paterson, the government's plans to reduce prison overcrowding. But is early release of violent and sexual offenders really the answer?
The first 100 days might be over, but President Trump is showing no signs of slowing down.
America will soon be greater than ever before.
So we're continuing to follow every twist and turn of this remarkable presidency.
And trying to make sense of what it all means for the US and for the rest of the world.
So join me, James Matthews.
Me, Malika Kellner.
And me, Mark Stone.
For Sky News Trump 100, wherever you get your podcasts.
You do the crime, you do the time. Well, that used to be the mantra. But what happens when there isn't enough room in the prisons? The Labour government asked the former Conservative Justice Secretary David Gauke to review the way courts sentence criminals, and he's come forward with a set of proposals that range from releasing criminals after just a third of their jail term all the way to chemically castrating sex offenders. Yep, it's all pretty controversial. Just have a quick listen to the Justice Secretary Shabana Mahmood and her opposite number, Robert Jenrick, in the comments.
It is shameful that in this day and age, we are confronted by this crisis once more.
Absolutely.
The reasons are clear. The last government added just 500 places to our prison estate.
What do these changes amount to? A get-out-of-jail-free card for dangerous criminals. It's a recipe for a crime wave.
Our political correspondent Liz Bates is down in Westminster. Good to see you, Liz. Look, plenty of people are describing this as the biggest shake-up in the justice system in decades. I mean, is that right? Just walk us through it.
This really significant change here is the change in direction, because certainly under successive Conservative governments, the way that the tide has been going has been in the prison population rising and rising and rising for lots of different reasons, but they all come under the same umbrella, basically, which is that once you get into government, it is very difficult to start emptying prisons. It is much, much easier to start filling them up, because every government, and especially Conservative governments, I think it's fair to say, because that's more in line potentially with their ideology, is that they want to be very tough on crime. And the way that you look tough on crime is that you send more people to prison. And there's also a drive to increase sentences, because there's periodic outrage over certain crimes. So if there's a horrific murder that involves children, the way that the government responds to that is by increasing sentences. So that's the way that things have gone for now many, many years in politics. What this government wants to do, the prisons are full, they want to change direction. The question is, can they do it? How well will some of these policies go down?
OK, so walk us through. What exactly is the government's plan?
So what they want to do is basically move away from prisons and move towards community sentences. So things like community service, but also things like tagging offenders and, of course, this use of chemical castration. They want to limit short sentences. So only in extreme circumstances now will short sentences be used. And there's a lot of discussion around that. I think the accepted wisdom on that is short sentences leave no room for rehabilitation. But what they do is often embed people in a kind of life of crime because of the way our prisons are, because there's access to drugs, because they mix with other criminals. The controversial bit, I think, could be cutting longer sentences short. So the issue that has come up today that campaigners have raised some red flags about is this idea of cutting somebody's sentence by 2/3 if they are shown to have behaved well in prison and moving them out into the community. Now, that could apply to sex offenders or domestic abusers.
OK, so how on earth are they going to sell this? I mean, it is bold indeed to say that violent criminals, that sexual offenders should be allowed out of prison before even half of their sentence has been filled.
It's quite clear what the government comms plan was for today. They realised they didn't want to look soft on crime. They didn't want the Conservatives to accuse them of letting sex offenders out. They didn't want that to be the big headline. And so instead of that, I think that is why they've thrown this chemical castration idea into the mix. It's not kind of mandatory chemical castration of all sex offenders. It's a trial that they're rolling out. But I think they really wanted that to be picked up by the newspapers today, because that makes it look like they're being very tough on crime. and maybe overshadow some of the things that they don't want people to talk about as much.
So if we're not going to be sending people to prison after they've committed a crime, and we're going to be letting people out of prison early once they have committed a crime, what are we going to be doing with them in the community? I mean, the probation service is overstretched as it is.
The probation services are overstretched, and that is really an aspect of public services that has been through a lot of turmoil. I mean, if you remember, it was under Chris Grayling, a previous Justice Secretary, privatised and then renationalised under David Gauke, the Justice Secretary, who realised that was a complete disaster. The probation service is really trying to kind of put itself back together. And yes, it piles a huge amount of responsibility onto them. Now, what the government would argue is that long term, this has a very net positive effect on crime, because the probation services do much more successful and effective work, and that has been proved many times, on rehabilitation than the prisons ever can do, just purely because of the state and pressure of our prison estate. Now, the other aspect of this is things like community service. Now, we did a special at Sky on prisons and probation services. I went to a community service project, and it was hard work. It was not some kind of fluffy, turn up when you want, have a cup of tea and go home type of project. So it's not the easy option. It is more successful long term, but of course it does create this difficulty, which is those people are back out in the community, and it's difficult to keep them then away from their victims. And if it all goes wrong, it's going to look pretty soft of the government to have let them all out of prison.
But here's the problem for this Labour government. The only reason that David Gauke was brought in was because prisons were at capacity. We've heard from the Justice Secretary that we're going to run out of space in November. Everyone knows the prison estate is falling apart. I mean, if we had more prison places, this government wouldn't be doing this, would they?
Certainly the opposition would argue that this is a policy of complete necessity. Now, what the Conservatives have been saying today is you should just be building more prisons. The interesting thing, though, about this sentencing review is that David Gauke, a former Justice Secretary, has always thought this. He looked at the justice system as a whole when he was in office, and it was not at this crisis point. And he thought short sentences were a terrible idea back in 2018, and that community sentences were much better. And he's not the only person that's thought that. So this is a long-term policy idea from a certain section of British politics. It's always been very difficult to implement, but this government is going to have a go at doing it.
Thanks, Liz, and we'll be back with her just a little later. Perhaps the most controversial suggestion from the review is the use of drugs on sex offenders. Some use the shorthand of chemical castration. So let's talk to someone who knows a lot about it. Professor Belinda Winder is part of the Sexual Offences Crime and Misconduct Research Unit at Nottingham Trent University. She also happens to lead the national evaluation for the use of drugs in managing problematic sexual arousal. That also includes the pilot scheme mentioned directly in the Gauke review. And Belinda, maybe we can just start there. Just explain your involvement in that.
This pilot in the Southwest has been a really interesting project for the last couple of years. The pilot has been looking at the transition as people move from prison to the community. What does that service look like? Do people get kind of lost in between prison and community in terms of continuing the medication prescription? And Southwest Pilot is also looking at the service just being offered in the community. So at the moment, for people who have left prison, but hopefully one day, I think it should be offered to people as a prevention. So for people who are struggling with sexual preoccupation in the community before any offence is committed.
Belinda, can you explain exactly the phrase that's been in the news this morning, chemical castration? I'm not even sure if that would be the term that you would use. Can you just explain what it is, what we are discussing here?
So you're right, I don't particularly like the somewhat misleading term chemical castration, but I have seen another term used, chemical suppression, which is probably a better term. So we're looking at medication that can reduce the levels of sexual urges and level of sexual interest for someone. So if you've got problematic sexual arousal, it's like listening to a radio station, but the radio is turned up to maximum. So that's pretty much all you can hear. And it's, in this case, it's just saying sex, sex, sex the whole time. So imagine if you're going around your daily life and you had a kind of radio set attached to you, and all it played was one channel yelling really loudly at you, kind of sex. People with problematic sexual arousal have kind of described it like that. It's not being able to think about anything else. Everything you do is almost geared towards sex or thinking about sex. And these types of medication, what they do is they turn that volume right down, and actually in some cases can turn the radio off. And that means there's a whole world out there for people to interact with in an appropriate way. It's being able to live a full life which is not dominated by just the thought of sex all the time, everywhere, wherever you are, whatever you're doing.
You've been involved, of course, in a number of pilots, including the scheme that's going on at the moment. So, I mean, simply put, does it work?
Yes. When I started the evaluation of this medication back in 2011, I didn't know. I was just asked to evaluate the medication effective. And my experience to date and my evaluation work to date tells me, yes, absolutely, it works. It works really well.
I suspect that there will be plenty of people concerned about this for a variety of reasons, but I suspect that one of the bigger reasons that people will be concerned is they can understand how these drugs can be administered in a prison environment. But this is the sort of medication that would need to continue to be administered once they had left prison. And how does one monitor that? How does one enforce that?
Well, it's not so much a question of enforcing, really, but we know that about 9 out of 10 people who've been convicted of a sexual offence won't go on to be convicted of another one. We know that there's a still far too high, but a much lower rate of reoffending than people realise, which is good. But we also know that the huge majority of people who have committed a sexual offence do not want to do so again. And I realise that goes against kind of what is understood in the public arena, but that's what the evidence tells us, that's what the data tells us.
These schemes up until this point have been voluntary. Those who have been on the pilot schemes have all put their hands up and asked to be on them. We're told that the Justice Secretary is considering whether or not to make this sort of chemical suppression, as you describe it, mandatory. I mean, talk about an ethical minefield.
Yes, and also our evidence base was all around people taking it on a voluntary basis. So either people refer themselves, or often a member of prison staff will suggest to someone they would benefit from the medication. So it is a whole different system if we're now talking about mandatory medication. And I think, you know, the evidence base would perhaps be completely different. It wouldn't be about people's well-being. It would take away the idea of this is a tool that people can have to support them in their rehabilitation, in their desire for a life that doesn't involve any kind of harm to other people. So it would be a completely different kind of world we'd be looking at, and I think it would be less effective.
Our political correspondent, Liz Bates, is still here. And Liz, look, it's been a rare old week for this government to kind of move it away from sentencing just for a second. They have apparently reopened the debate around Brexit. On top of that, you know, one of their most eye-catching policies so far, you know, increasing national insurance contributions on businesses and taking away money from old people to pay for their fuel in winter. I mean, is it possible that this Labour government can come up with a policy that doesn't divide opinion entirely? Have they got anything that we might all like?
Well, that's quite a damning laundry list that you put together there, Neil. I think most of it is just incompetence and a bit of a lack of a kind of coherent plan for government that they did tell us they were putting together for their many, many years in opposition. And we're not seeing it rolled out in any kind of successful or predetermined way. And voters are not loving this first year of a Labour government. And as you say, do they have any successful policies in their back pocket? I'm not sure. We haven't seen them yet. Hopefully for them, you know, they can come up with something, but I'm not going to hold my breath, Neil.
And that is your lot for this edition of The Daily. We are back again tomorrow.
The first 100 days might be over, but President Trump is showing no signs of slowing down.
America will soon be greater than ever before.
So we're continuing to follow every twist and turn of this remarkable presidency.
And trying to make sense of what it all means for the US and for the rest of the world.
So join me, James Matthews.
Me, Malta Kellner.
And me, Mark Stone.
For Sky News Trump 100, wherever you get your podcasts.